Well, hello, good morning, good night, middle of the night, wherever it is in the world. We've been doing this since 6:30 last night in New York, where we started with a very early morning session from Brisbane, Australia. And here we are about 24 hours later. And you've met some of the leading law enforcement and policy people around the world, and lots of people who've been affected. We have a mom whose daughter committed suicide after she was raped, and those pictures were shared online. We have the human and law enforcement and the policy perspective, but many of you have questions, and the place to go, I think, is to an adolescent psychiatrist. And I have someone just for you. This is Faraz. We met on LinkedIn. Surprise! That's where I meet everybody. And he works in Westchester, very close to New Rochelle, the town that was first sequestered. And he works with children and adolescents in psychiatry. He's a fellow at a very, very well-respected medical facility there. And so I've asked him to get involved with us. And of course, he was the first one I said, you have to do a session with us. So Faraz, welcome.
Thank you so much, Parry.
All of my friends are telling me not to touch my face, so of course I'm touching my face all the time now. But
Just make sure you wash your hands.
yeah, my dog is in doggy daycare just because I'm spending so much time washing my hands all the time. He
Mhm,
doesn't know quite what to do with me. So, tell us a little bit about your role at
mhm.
Westchester and what you do traditionally, and then we'll get into the digital part.
Absolutely. So, I'm currently a final year child and adolescent psychiatry fellow here at Westchester Medical Center. So before I started my fellowship, I did my training in adult psychiatry. So I'm board certified in adult psychiatry, and currently I'm a second year fellow. Will be graduating in the next couple of months, and I would be board eligible in child and adolescent psychiatry.
Now, having had been married to a doctor, and my sister's one, and my brother-in-law's one, and everyone I know
Mhm,
is one, a fellow
mhm.
doesn't mean that you're practicing. You are really a doctor. You are board certified. You've gone through all the training. You've taken all the tests on adults, and
Yep.
now you are specializing again as a fellow
Yes.
over a 2-year period on children and adolescents, and you're almost done there. So I don't want anyone to
Yep.
think that you're an intern just
Mhm.
getting started. You are
Sure.
certified and an expert in this space. So thank you so
Yeah.
much for finding time.
No
Um,
problem. And we do a lot of work in especially with the children. For the past 2 years, I have been working only with children. So we see children in the ER, we see children on the pediatric floor, we see children who comes to our OPD. So right now, I'm just dealing with children and adolescents having a lot of mental health issues. And going forward, actually, I'm going to be working up north of Westchester as a child psychiatrist.
and we're going to use your services even more to help advise parents. And I know this is a difficult time with Corona, and
Hmm.
we may be able to start with that just a little bit because, in
Hmm.
my experience, when young people are
Hmm.
exposed to tragedies and trauma and uncertain
Hmm.
times, when their parents and support networks aren't functioning the way they are, they're wrenched from school and told they have to learn
Hmm.
everything online, whether they can or not. These are times when they're more vulnerable to um, predators, people who want to engage them in these activities. So Corona is directly connected here. Who thought? But could we talk a little bit about that, the new vulnerabilities that we might expect to see?
Absolutely. Actually, I was just thinking about it today, surprisingly, what? Because all the kids are out of school, they're home with the parents, and first of all, the parents are not used to able to spend time, so much of time with the kids, and it's very challenging for the patient, for the parents as well. And especially with the lot of anxiety, kind of, the environment was around here especially in New York and Westchester County, these kids are going through a lot of anxiety, dealing with the anxiety, of their parents, dealing with the anxiety at school, and dealing with the anxiety what's happening online, when like online and in the news. It's a pretty stressful time especially for the children, because it's entirely a different field now, because nobody has ever, nobody ever had a situation before, like, not going to school, doing everything online, and like everybody around are hoarding groceries. They see that and they can, internalize it very easily. That's the problem with children, that they internalize things what happen around them.
And the more stressed they are, the more vulnerable they are as well to people who offer
Absolutely.
them stability.
Absolutely, because once they're doing start doing classes online, they're sitting online looking at stuff. We don't know what they're doing unless somebody, a parent supervises them, which is not possible all the time. So they can go online and just click on something which they're not supposed to, or do things because they have more time at home now to do something which can be more impulsive, or just to connect to outside world. So, and this is a pretty vulnerable time for the predators to find kids online.
It is, and the parents are so stressed they'll miss it. And a lot of kids who are might be regulated at home as to what technology they can use and how long they can use it for. Parents don't know how to enforce those rules when the kids are attending school entirely
Right.
online, or the parents think they are on devices that the parents can't control. So all of a
Mhm.
sudden, we're throwing kids out on their own. They can't play with their friends. They can't go to support groups. They can't go to school activities and sports and all of the things they want to do. So they are focused entirely online in a very isolated
Mhm.
way. And so I'm concerned about this. It might give us opportunities to reach them. Unfortunately, there are
Mhm.
too many others who are trying to reach them at the same time.
That's true, because right now we are putting these kids in a socially isolated situation, and for them to connect to outside world, digital media is the best thing, right now, because they are, through digital media, they don't have to meet them in person, they are not in close contact, they are missing all the activities, they're missing school, they don't know how to basically use their time. So now they expose themselves, to these predators and to unnecessary things which are there online, and they can get exploited through that.
Yeah, they can, and I'm very concerned about that. Maybe we need less social distancing and more social media distancing as we start
That's true.
moving forward. Um, so you have in your practice, I imagine, seen a lot of kids who are surviving cyberbullying or trying to heal from it. They may have been
Hmm.
sexually exploited. They might have taken sexting images that got out or they
Hmm.
fear are getting out. What kind of things are you starting to see in your practice that relate to digital?
So, to be honest, I see so many patients, especially being depressed because of sexting and being exploited, getting cyberbullied, getting victimized online. I see so many patients. I think I told you like a few weeks back. Let me talk to you about that case. I remember a few weeks back, I was on a pediatric neurology, and there was this kid, 16-year-old female, and she was on Instagram talking to some adult male, and mom found out about it, and she took away her cell phone. And she was so impulsive. She went back to her room and she hung herself, and she was taken to the ER, and she was in the ICU. After 2 days, she was declared brain dead because she was not responding. Her EEG was like flatline, and when the mom was told, what happened with the kid, and now she's brain dead, she cannot be back to normal ever again. It completely shattered the mom. She took, she felt she was responsible for the death of her own daughter. Even though she had three other kids, still, it kind of created a big hole in her life, in her soul, that I don't know, how much time she's gonna take to recover from that, because she's gonna just feel guilty about doing this. Just taking away a cell phone. It's just such a little thing. We think that, oh yeah, we're just gonna take away the cell phone. Everything is gonna be fixed. But the way the kid, her daughter, perceived it was very different from how as an adult, you and me are going to perceive it. And it
Absolutely.
completely shattered that cred.
Well, there's a Leah Parsons is a woman whose daughter committed
Oh,
suicide. Her
yeah.
daughter was invited to a sleepover with a friend. Leah had called and
Mm-hmm,
checked. And this is in Nova Scotia, a place that's relatively safe. And
mm-hmm,
there were two boys who lived in the house. They ended up giving her
mm-hmm,
lots of vodka. She was drunk.
mm-hmm,
She wasn't used to drinking. Her friend left.
mm-hmm,
Two boys came over, and
mm-hmm,
she was raped by four of them, and they took
mm-hmm,
pictures of the rape and they posted them online. She was 15 at the time. She and her parents tried to address this, get them prosecuted, find fairness,
mm-hmm,
take the pictures down,
mm-hmm,
and she
mm-hmm.
was
Uh-huh.
unable to get the relief that she needed. And when 17 months later, Ratea took
Mm-hmm.
her own life. But Leah is doing a lot of grief counseling. So I'm happy to connect or give you the content so that you can put Leah together with this woman. Um, we don't understand as parents the
Yeah.
relationship that young people have
Mm-hmm,
with digital technology. They may be lonely, they may be lost, they
mm-hmm,
may be socially excluded. They're looking for more friends, they're looking for better friends, they're looking for self actualization, they're looking for
mm-hmm,
all of these
mm-hmm,
things. And they too often look to the
mm-hmm,
ether, they look to the digital
mm-hmm,
to provide that. They have a horrible situation at home, they'll go to strangers
mm-hmm.
online for advice. They're not sure of
Right.
mental health issues, they'll Google it. And they are so connected to these that when parents discover that their kids are
Mm-hmm,
engaged in high risk activities and involved with sexual
mm-hmm,
predation, when the parents take the technology, that the kids feel
mm-hmm.
so lost and so disconnected that we're seeing a lot of attempted suicides as well as successful, unfortunately, successful suicides.
Yeah, yeah. I mean, a lot of patients, they come to our ER, especially kids ranging from what I have seen is like from around like 10 to 16. They come in with suicidal ideation to the ER when when the parent take away their cell phone or when the parent take away their video games, their Xbox, because that's how they're connecting to the outside world. And one thing which really saddens me is um, the mental health part is being undermined because around 20 to 25 patients in percent of these kids have a history of depression. And I was just reading through some articles, and they said that around 50% of these kids have anxiety problem, because of which they are getting more engaged in a digital way with the outside world. And especially parents, while growing up, they are in a completely new era now, where they were never exposed to Instagram. They don't know what Facebook was, what Snapchat was. They had no idea and what kind of influence it has on their mind. So it's hard for them to basically comprehend what effect it's having on their children. So basically they're not able to connect it. So I would say the parents as well, they need a lot of education how to basically deal with the kids who are addicted to digital media, social media, to texting, sexting. They need to be educated how to deal with it. And they have very limited education. The best thing they know is take away the cell phone. It's going to solve everything, and it's hard for them to basically understand what the kid goes through. Like you said, nowadays the best way a kid connects to outside world, to her or his friends or to anybody outside, is through their cell phone. And once you take away their cell phone, they kind of feel that their whole world is shattered. They don't know what to do. They feel socially isolated. They become depressed. They don't know how people, because they're not able to connect to outside world at all. They feel that this is the end of world, and they take such impulsive steps which might have short-term or long-term effects on their physical health. So I believe that the parents need to be educated as well when they have this crisis situation, how to handle them, and they need a lot of education on that.
They do. And unfortunately, our healthcare system doesn't give us access to mental health professionals that we deserve. It's so hard to get coverage there, and everyone keeps saying, get out of it, just go out, listen to music. You're thinking too hard. In every case of bully side, cyberbullying
Hmm.
related suicides that
Hmm.
we've seen,
Hmm.
every
Hmm.
single one of the targets has had mental health issues. They were being treated or seeking treatment or under medication for social anxiety, for depression, for stress related mental health issues. And they are just very vulnerable. And I have programs for children who are deaf and hard of hearing. I have programs for children on the autistic spectrum. It's time we start putting together programs on cyber
Hmm.
safety for those with mental health issues and vulnerabilities that are related to mental health. And I think it will help psychiatrists and psychologists and social workers and guidance counselors and parents and young people themselves tackle this issue and find a
Hmm.
way to protect themselves when the moment of anger, frustration, loneliness hits and they choose
Hmm.
death instead of life.
That's true. And the sad part, like you said, is the access. Especially in this country, there is a very poor access to professional treatment, like especially when it comes to children, like child psychiatry, child psychology, very limited access. And they need to definitely work on it, how to improve, how they can improve access to these kids, especially getting mental health treatment, like I said before. Like around there's research, like 20 to 25% of these patients who are sexting, who are addicted, to social media, they have a history of depression. Around 50 to 55% have anxiety. What they're trying to get through digital, through sexting, is they are trying to save their relationship, either to start a new relationship or to sustain the relationship. That's what they're trying to do. And especially when anxious kids, what happens is they are scared to have a personal one-to-one interaction. They are scared of feeling rejected, in person. So they feel that, through sexting or through, messaging or getting involved in a way, like sexually getting involved through social media is a way to avoid that. And it's hard for parents or to people around to understand that. So these kids, they need help. They definitely need help. And access is a major problem at this point in the country. And there need to be policies. They need to have the policymakers need to work on it. How we can increase access to these kids. Like I'll give you some statistics. In Montana, like I'm telling you, in entire state in Montana, there are I think there's one child psychiatrist for 100,000 children. Can you imagine one child psychiatrist? Even in place like New York, there are, I think, if I'm not wrong, there are like 26 or 27 child psychiatrists for 100,000 children. It's sad. It's very sad.
It's
You
so
know,
sad. And
again,
and digital technology builds on their vulnerabilities and makes many children
exactly.
more vulnerable. Resilience is an issue, and too many, especially in the industry, when we turn around and point fingers saying, "What are you doing to keep kids safe?" They blame it on the kids. Well, if the kids were more resilient, we need to make more resilient children. It's almost like she was wearing a short skirt and asking for it after somebody was,
Yeah.
and it's just making me sick. So, what can we, as cyber safety
Hmm.
professionals, I've been doing this for 26 years for us,
Hmm.
um, what can we do to help people like you, people in the mental health um, uh,
Hmm.
ecosystem? How can we help you understand the risks and some of the practical solutions of digital technology?
So, still as a trainee though, but after so much of experience with kids, I have very limited knowledge about cyber safety, cybersecurity, how these kids get exposed to all these vulnerabilities. So I think as a security expert, what I would suggest people around the world or everywhere, that educate these people who are involved in mental health, because they have very limited knowledge about it. They don't know what are the legal implications of it. They don't understand how kids are getting dragged into it, because we just see the outcome of it. We don't see the process, how these kids are getting pulled into this. So that's something I would say. Education, I think, is the key, especially, if you can go out and educate mental health professionals how these kids are getting more vulnerable to these predators. So maybe a way we can screen these kids, on the initial intake, that are you getting exposed to this? Are you sexting? Because there is data that the kids who do a lot of sexting, they have a very risky sexual behavior. Not only just risky sexual behavior, they get involved in drugs, or all the risky behaviors. They have a lot of suicidal thoughts. They contemplate suicide, and even if they are getting depressed, more and more depressed because of cyberbullying, you know, and getting victimized, it reaches to a point where they do commit suicide. And I, as a professional, I do see that a lot in our clinical setting. So as a cybersecurity professional, I would say, please go out and educate these mental health professionals about the risks these kids are taking, because of getting involved in all this risky behavior, so that if we can just screen them on initial visit, we know how to get them help.
I think that's a great idea. We have a program called Cyber Wellness that's designed to train and certify mental health professionals and physical
Mhm,
health professionals, healthcare professionals on digital risks and solutions, and giving them
mhm,
resources they can use, videos they can put in their office, things that they can
mhm.
email and put on their website. So we're working on that. Now, hopefully you will help me frame what we need to do for mental health professionals. Uh,
Absolutely.
it's crucial, and we're losing children, and nobody's paying attention to this. So Facebook will come up with something to address suicide based on certain search words because it's good for the media, or someone's yelling at them from the UK government. They're short, they're not consistent, and it's time that we stop
Mhm.
seeing this as a competitive issue and recognize that all children deserve safe, private, and secure communications. Parents need to know what's going on, but in the end, we need to hold the networks and providers responsible for making things safer and giving access to where it's due. So let's figure out if we can find a grant or two we might be able to work on once your training's up.
Absolutely.
I'd
Yeah,
like
two
that.
more months.
2 more months, that's
Two
it.
more months. Yeah, two
So
more months,
It's
and we
June
can. I
30th,
would love
right?
to be a part of it.
I love this.
Sorry?
I can't. It's June 30th is the last day of your fellowship. Is it?
That's true. That's true.
You can
But
tell I'm
I'll be
not talking to my
graduating
family.
first week of June. Yeah.
Well,
So
we're going
I'll
to
be
certify
graduating
you
in first
first.
week of June.
Well,
Sure, absolutely.
we're working with the IEEE, which is a standards association, on
Mhm.
engineering standards, Wi-Fi,
Uh-huh.
AI, all of those kind of things. And we're designing the cyber safety, including cyber wellness standards that will
Mhm.
help understand this. And there are lots of groups around the world that are looking at best interests of a child, cyber wellness, what's really good for kids. And as professionals, it's our role to step in, even if we're lawyers, as opposed to being smart enough to be doctors, as my sister always reminds me. So,
But the work you're doing is incredible, Parry, and I really appreciate that, because there are very few people around I see who are so, involved in such kind of work. Very few people. And I really appreciate that. And there's a reason when you called me, and I really was like so eager to talk to you,
well,
because I see kids suffering.
and you're on the front lines here. For us, you are there,
Yeah,
you see them and try to resuscitate them after they've hanged themselves in their closet or on doors, handles. You can so easily get information on how to take your own life. If you're a child online, you search for it, and it's so much harder to find ways to get you the support you need so that you won't. Parents need to be more
yeah,
trustworthy. Medical professionals, mental health professionals need to understand the high risk issues and intake. We do this with first responders in law enforcement. We can certainly do it for first responders on mental health, and it's time.
absolutely.
Um, we're also
It
seeing
is
a lot
time.
of
It's high time. it's very high time that we need to take an action. We need to do something about it. It's not just about talking. We need to do something about this, especially when it comes to children, because it's very hard. It's very, very hard on the parent. It's very hard on the society. It's very hard on the clinician as well, who is seeing, the patient as a first responder. It's very hard. So we need to, everybody in the society needs to come together and make plans what we can do better, how we can secure their future, how we can safeguard our children from these predators. It's very important.
That's why after 25 years of running the world's first cyber safety group, we're now creating a new cyber safety charity to look at ways to professionalize the industry, create a safer ecosystem, make sure that all stakeholders are included, especially you, Faraz. So you got to finish your fellowship soon because I'm going to keep you very busy. Uh, one of
I,
the
I would love to do that.
one of the things I want to raise with you, and I know I promised I'd let you go back to
Uh-huh.
your kids, is there are a number of cases that I work with and parents who come
Mhm,
to us for help. And they
mhm,
find that their teens or preteens are engaged in active communications and sexting or providing sexual information or
mhm,
content to the bad guys. And when the
mhm,
parents discover it, the young
mhm,
people will, before the parents can take the device, will reach out and warn the predators because they've been so good at isolating the child from the parents and trustworthy players and bringing them closer to them through grooming that they will trust and
mhm.
protect their abusers before their parents. So could you talk about a little bit, just a touch on how grooming can change the mindset on who's trustworthy and who isn't?
So again, let me just go back a little. How a normal child grows. Let me focus on that a little bit. Especially the teenagers, they're high on basically they're at the peak of their sexual drive. So they trust people who are basically going to comfort them in a sexual way. And it's very easy for these predators to recognize that, and especially very vulnerable kids, and they see it. They see that vulnerability, that how we can make this kid trust us more than the parent. And you are in that developmental stage that you will trust others, your friends, more than your parents, is the normal growth curve. So, especially so these predators, they do realize it, and they do target these kids who want some kind of satisfaction or comfort in a sexual way or in any other way. They do realize it, and they take advantage of it, and they try to groom them by comforting them in a sexual way or trying to tell them things which their parents won't say, because parents are busy at work 9 to 5 or 9 to 6. We don't know how long, and they usually see their parent for a few hours in a day, only for the dinner. And these people, or these kids, when they come back from school, they're hooked to internet, talking to these people, and they are spending more and more time with these predators. So that's how they realize it, that okay, this kid is spending so much of time online and trying to talk to me. It means that this kid is trying to get more attention. So they realize it. And because the kid is not getting enough attention from the parent, I'm not blaming parent, because parents are busy with work trying to provide to their kids whatever they need. But these predators, they have no other thing, they have nothing else to do rather than trying to attract these kids and take advantage of them. That's how they're trying to groom them. The more time you spend online, they know, they realize it, that this kid need attention, and these kids are looking for attention because they are socially isolated. So that's how they're trying to groom them, and it's very hard because we don't know who they're talking to, what kind of things they're exchanging. It's hard for the parent as well because they're not available. Even if they're available, they're not aware of it.
Yeah, and the parents may be on the same technology that the kids are.
Absolutely. If you see nowadays when you go to a restaurant for dinner or something, everybody's hooked to a cell phone. Nobody's talking to each other,
I
even
know.
the kids.
And it's really sad. For us, I promised you that I would keep it to a half hour because you are a father and very busy. And
Thank
I meant that. And I am so happy that we met. I mean, the good thing about dealing with somebody who's from Indian and Pakistani and Middle Eastern backgrounds is we understand the soul, the karma, these things that you meet people for a reason. They come into your life at a time for a reason, for a greater purpose. And I truly believe that. And I am so grateful that we met on LinkedIn. And I'm so grateful that you're almost done with your fellowship because I need you.
Me too. Me too. I'm pretty glad that I was able to meet you through LinkedIn. I know it was pretty, surprising. I was like, wow, who is this person
Why is she
who just contacted
calling?
me on LinkedIn? Yeah, I'm like, yeah, I was like, who is this person? But when I read what you're doing and everything, it was like pretty fascinating. And this is something I like to do in future as well, because my main reason why I wanted to be a child psychiatrist was to help children. I don't mind if it's through medications or through therapy or any other way. My main motto in life is to be able to help children because they are the future of our society. They are our future, and we need to make sure that we make them strong. We make them strong enough to handle all the stressors they are gonna come. They're gonna face in future. That's my motto.
Thank you so much. You are
Thank you so
wonderful.
much, Parry.
Your patience,
All
people,
right.
you are very fortunate. I love you lots, and I'm going to keep bothering you.
Thank you.
But thank you so
Sure,
much.
absolutely. Bother me, please. Okay.
You are the best. Stay well. Stay safe.
You too. Bye bye, Perry. Bye bye.